And now, in a heartwarming display of international collaboration, Save a Child's Heart has launched its inaugural medical teaching mission to Rwanda, marking the beginning of a new partnership with the Rwandan Ministry of Health. Let's take a look.
In a heartwarming international effort, Save a Child's Heart embarked on its first medical teaching mission to Rwanda under a new agreement with the Rwandan Ministry of Health. The SACH medical team, consisting of Israeli volunteers from the Sylvan Adams Children's Hospital at Wolfson Medical Center in Holon, collaborated with local Rwandan and Ethiopian medical teams. Working 14-hour days, they successfully performed life-saving catheterization procedures on 22 children. Additionally, over 50 children were evaluated at a cardiology clinic by the combined Israel-Rwanda-Ethiopia cardiology team, showcasing a remarkable example of multinational teamwork and cooperation. Joining this mission were two medical fellows from Rwanda currently training in Israel, Dr. Jared Masago, a pediatric cardiologist, and Dr. Lise Mumpariz, a pediatric intensivist. A touching reunion was also part of the mission, bringing together 18 past patients from Rwanda who received treatment between 2007 and 2023. The reunion, attended by Israel's ambassador to Rwanda, highlighted the long-term impact of SACH's work. These former patients, now healthy adults in their 20s, shared their stories of successful recoveries and fulfilling lives. In a particularly emotional moment, the team welcomed back 9-year-old Luana, who returned from Israel after receiving life-saving surgery. Her homecoming in Kigali was a moving scene as her mother, aunts, and community members greeted her with overwhelming joy and gratitude.
What Save a Child's Heart is doing in Africa be great, but for my country it's even more important that we will have the opportunity to treat children with heart condition locally without needing to transfer them elsewhere, to advance pediatric intensive care and to save more children.
And joining us now in studio is Simon Fisher, the Executive Director of Save a Child's Heart. Simon, thank you so much for being here. I would like to just start by asking you about this incredible mission to Rwanda. I mean, what inspired Save a Child's Heart to do this mission?
Save a Child's Heart is all about the vision of one great individual, the late Dr. Ami Cohen, an American heart surgeon who made Aliyah to Israel at the beginning of the 90s. And his vision was to share knowledge and expertise with countries which lack the knowledge in the field of pediatric cardiac care. And he created Save a Child's Heart back in 1995 at the Wolfson Medical Center. To date, the organization has treated some 7,000 children from 70 countries around the world.
Wow, it's quite impressive. How did this collaboration between the Israelis and the Rwandans and Ethiopian medical teams as well, how did that come about, and what challenges did you guys face?
What's actually very exciting about what happened 2 weeks ago in Rwanda, and I'll take you back 8 months ago. October 6, I was in Kigali signing a memorandum of understanding with the Ministry of Health of Rwanda in the presence of the Israeli ambassador to Kigali and advice. And it was all about sharing knowledge, not only treating children suffering from heart disease, but putting together medical missions of Israeli doctors coming over to Rwanda and putting together a group of Rwandan doctors who would come to Israel and train. And we signed the MOU and came back to Israel. And practically everything else was history. October 7th, we found ourselves in a completely different reality.
How do you plan to build on the success of this mission and other similar missions that Save a Child's Heart has done? And of course, how can individuals support the work that you're doing?
So, 2 weeks ago was a very exciting time for Save a Child's Heart. Having been away for 8 months, we were in a very unique position to restart our program that we committed to the Rwandan Ministry of Health, to come to Rwanda together with an Israeli medical team, 10 medical professionals from the Wolfson Medical Center, together with 2 Rwandan doctors training at the Wolfson Medical Center through Save a Child's Heart, and to launch the first catheterization mission. What was very special about the catheterization mission, in order to do catheterization, you have to have surgical backup. And Very fortunately for Save a Child's Heart, the surgical backup at the King Faisal Hospital in Rwanda is led by Dr. Yayu Mekonnen, who's an Ethiopian heart surgeon, trained by Save a Child's Heart at Wolfson Medical Center some 7 or 8 years ago, who only recently relocated from Ethiopia to Rwanda to lead pediatric cardiac surgery in Rwanda. This is another wonderful opportunity that Save a Child's Heart has had to manifest how Israeli knowledge is shared throughout Africa, but most excitingly for us is the notion of South-to-South collaboration, seeing how different nationals from different African countries can work together to benefit Africa as a whole. And Save a Child's Heart, to a very large extent, has been a pioneer in this initiative. Save a Child's Heart activities couldn't actually happen if it wasn't for the tremendous support that Save a Child's Heart enjoys from supporters throughout the world.
Absolutely. Thank you so much.